X-ray. What can you tell me?
Got a sharp angle on the left.
We can see a bit of diaphragm on the left.
Diaphragm, absolutely nothing on the right.
On the right, yeah. Tell me about the lung fields.
Opacity in all zones.
In all zones, yeah. So some of that could be call it the Batman sign.
Yeah, okay.
Because it looks more like the bat symbol than it looks like bat
When
wings.
it comes
Yeah.
like up from the...
But the anatomical way to say that is vascular opacity, because it starts at the hilum, yeah? See where the bronchi is? You can see air bronchograms, beautifully air bronchograms here. That is also the hilum where the blood vessels enter in, so pulmonary arteries and pulmonary veins.
Okay.
So very prominent pulmonary arteries and veins, yeah?
Okay.
Upper lobe diversion of blood, yeah? Now, there's a few other things here that also are very kind of good at alluding to the fact that there's some cardiac failure here causing back pressure. One is, what is this? See this thing that looks like a tag? And then another one there. Yeah, so defib pads. So does this look like somebody that has heart sad face?
Yes.
And there is this tube here. And that tube is in the inferior vena cava.
Mm-hmm.
So why would you have a tube this big in your inferior vena cava? Because you're getting ECMO. Yeah. Can we see the arterial one being obvious? Weirdly enough, no. So there is an endotracheal tube. There is a nasogastric tube coming down, which we can't see the end of. This is the outside of the ventilator tubing, but there is a lot of white pixels, a lot of water in lung, because you can kind of see it's black next to white with airways running through it. There's more so opacity on the patient's right than the left, and we can see the diaphragm on the left, but not so much on the right. And a lot happening here that's both cardiac and inflammatory and infective in nature. So again, the endotracheal tube is there, endotracheal tube with a radiopaque marker. And as we scroll down, there's also a little tube in the esophagus. So this is the right upper lobe and left upper lobe. So there is some very dense consolidation both sides, and airways running through consolidated lung. Lots of airways running through consolidated lung. In here, see, there's not quite the delineation between consolidated lung and pleural fluid, which is not to say there isn't, but it might not be as obvious. It might be the way the scan is. But except for there is not a lot of airspace, yeah? But you can see lovely air bronchograms running through. So airways, and the picture of the airways running through water, because up here you don't see them because there's air in the airways and air in the alveoli. Here there's air in the airways and water in the alveoli, and that's why you see that difference in density. So maybe the edge of the lungs about there, it's very subtle. Very subtle hints that there might be some fluid in the pleural space. But you can see here there is some very subtle hints of air bronchograms in there too. So that's what we often look for on here, like behind the heart. If they're visible, like the airways are visible behind the heart, then that's a sign of consolidation within the lung. But I never say that. I just say opacity, left lower zone, loss of angles. Because that's all we action. Like for positioning, like what position would be good for this person? And the short answer is none of them. Mostly because of the ECMO. Oh, that's beautiful. Where is it? See those branching airways? Lovely air bronchograms running around. So somewhere here there is a reasonable amount of gas going to this right middle lobe, I guess. Lovely air bronchograms running through the lower zones. So yeah, I think the lungs do come pretty much to the edge there. And then there's a bit of airspace down the bottom here. So when we said we could see the diaphragm on the left, there is actually reasonable airspace in that section, but not in this. So, you know, in its own weird way, the right lung is worse than the left. So position-wise, what position might be helpful? Yeah, but is the left lung also good or not good? So we'd have to think about both sides. You can see the actual tube in the inferior vena cava there. So that's the port for ECMO, the inferior vena cava. What is this? Big organ in your abdomen. It's the biggest organ in your abdomen.
Is that we're down here?
Yep.
Stomach or diaphragm?
What's bigger than them? Your diaphragm's a very thin layer of muscle. See this layer of muscle right there? That's your diaphragm.
Okay.
So above the diaphragm is lung. So this is the right. What is below your diaphragm on your right? Liver. Good one, Charlie. And then below the diaphragm on your left is, at the back, the spleen. So that spleen looks like a little mini liver. And then there is the stomach. Oh. So that's the stomach. That's the liver. That's the spleen. And this kind of circular thing here is the aorta. So the aorta kind of runs down the left side of the vertebral bodies. This is a good thing to look at when we're looking at hardware in somebody's spine. If the hardware is in bone, good. But if the hardware is not in bone, is it anywhere near this thing? Because if you punch a hole through that, what's going to happen? Not good indeed. So lots of air bronchograms in consolidated lung, maybe small amounts of pleural fluid, but not very obvious. Right significantly worse than left, and a very strange okay left lower lobe for reasons unknown, and that's why we can see a nice diaphragm behind the heart. So that's the heart. That's the right ventricle, left ventricle. It looks quite large, and the heart doesn't look very good or normal. So you can almost see a four-chamber view about here. Right ventricle, left atria, right atria. And from the right atria, we get the vena cava. Yeah. So inferior vena cava, and then superior vena cava coming up here. So that makes sense. So very messy picture and very messy CT scan.